Hi, I'm Rachel from Parent Survival, and today I'm joined by Lucy. She's our fertility expert who's kindly come along today to answer some of your questions. Lucy's actually from Catching Rainbows. You can check out her website www.catchingrainbowsfertility.co.uk. Do you want to just introduce yourself, let everyone know a little bit about your background?
Yeah, hi, I'm Lucy, and my background is basically I'm a registered nurse, and that's where this kind of all began, and then I've combined that with a range of kind of complementary counselling, Reiki, reflexology, hypnotherapy, all sorts of things that complement what's going on when you're undergoing fertility treatment or struggling with miscarriage, loss, or I guess I kind of ended up being a bit of a fertility detective. I think that's where I'm at now. I'm the one who comes in and, why are you not getting pregnant? Why is that treatment not working? And why has your IVF failed? And it's just digging through all of that, but at the same time, just applying a large dollop of TLC at the same time.
That's fantastic. We're so lucky to have Lucy here today. So basically, we've asked people via our social media and our website to email in questions that they might have if they're going through fertility issues or IVF or things like that. So we've had lots of questions sent in that Lucy's going to really kindly answer for us today. So should we
crack
on?
Yeah,
So the first one, this person would like to stay anonymous, but she's basically said, we have a 9-year-old daughter. We've been trying to conceive again since she was 2 years old, so for about 7 years now. She hasn't had any miscarriages, she's had no positive pregnancies. She's been receiving fertility treatment for the last 2 years. All the tests have come back clear, and on paper they're both in working order. But except in December, she had 2 large polyps removed from either side of her uterus, both measuring over 1 centimetre each. She's tried Clomid and Ovitrel. So I'm not pronouncing these right. Prior to the polyps, she's now on Gonal and Ovitrel.
Yeah, Gonal-F. Yeah.
Gonal-F, sorry. What are your thoughts on the polyps being the cause for her lack of pregnancy?
Ordinarily, I would say polyps don't tend to get in the way.
Okay.
But on the other hand, I kind of want to say, yes, that'll be what it is, because you want to feel like you've had that removed and now that's sorted. What polyps can do is they can affect the behaviour of your uterus and the lining. So it may be that it has contributed to the way that she is bleeding and therefore the way that she's building up the lining for implantation. So it may have had an impact, in which case having them removed, she might well be absolutely sorted. But what I would say is, given that it's been 7 years and that she's been having fertility treatment, sometimes the fertility clinics, which I love, by the way, and I'm a very much pro fertility clinics and fertility treatment. It's just, I want the right recipe at the right time for the right person. And sometimes they don't look at everything. And I found with a lot of ladies who've had secondary infertility, it's worth looking at what's happened since you had your baby. There are various things that have gone on. You might have something physical going on where your cycle is behaving in a way that is not conducive to natural conception, and there are some really nice natural things that you can do to get your period back on track. So it's worth looking at things like, if you were sat in front of me, I'd be saying, tell me about your periods, tell me how you bleed, whether you're getting clots, whether you're getting brown spotting, how your periods are behaving, give you quite a lot of clues as to what's going on in there. So it's really important to look at that, and certainly there's lots of tips on our website actually about how to cope with correcting your periods, and just natural things that you can try at home.
Would you suggest people keep a note of it then through their period, of what's happening with the period, like how heavy they are, how long they're lasting, all that kind of thing?
Yeah,
Would you keep a journal?
Most women could just sit there and tell you. Well, day 1 is, I spot for this long, and then I come on, but I have 3 days of really heavy, or I have really lots of clots, and some of those are just gentle hormonal imbalances, or just literally your womb needs a bit of a cleanse and a clear out, and something like a castor oil pack or fertility massage or some supplements that will help with your hormone balance, or a little tweak in your diet can make a huge impact to what your periods are doing. And bizarrely enough, it can literally act as contraception if that's not quite right. And for some women, their fertility threshold, I would say, is quite low, that if something's not quite right, you're not going to get pregnant, but you just put that right and it will be
a small
absolutely fine. So it could be physical, but I would also say it's worth looking at what's happened to that lady with her first pregnancy, because I do find with some women with secondary infertility that they've had a difficult birth, or they've had a traumatic time with postnatal depression, or something has happened that's created a trauma around that time.
Yeah.
And the body and the mind work very closely together, and sometimes it literally just clamps down and says, not going back there again.
Wow.
You know, and until actually you can help that lady to deal with that and work through it, then the path kind of opens for the body to welcome the idea of pregnancy again, which sounds kind of far-fetched, but is a true thing that I've worked with quite a few women on that. But I never have an agenda going into these things. I never think, well, it'll be your mind, or it'll be something wrong with your period. It's just I have all these sort of tools at my disposal to kind of look at under every stone, if you will. So
you said, the fertility detective kind of.
Yeah, exactly.
That's brilliant. Thank you. She also asked, what are your thoughts on IVF Lite?
IVF Lite is basically like mild IVF. So instead of going gung-ho with more aggressive treatment, they give you very mild drugs to stimulate, to kind of try and get you to maybe produce 1 or 2 really good eggs in the hope of getting a good embryo. And for lots of women, that's an amazing concept, because maybe they don't respond very well to the aggressive drug treatments, because if you have a low ovarian reserve, your ovaries don't like to be poked and prodded too much, but they would a bit of gentle nurture, they will come out and do something. So in certain situations, IVF Lite is fantastic, and it really helps people just to get that one really good embryo and pop it back. I would just say, you need to make sure that if you're going down that road, that the reason you're not getting pregnant is because you're struggling to make a good embryo. And I would want to rule everything else out first. And that doesn't necessarily mean it will take months or years, but literally one conversation can sometimes turn up. Well, you know what? You're ovulating on day 20 and you're coming on your period on day 28. That 8 days is not enough for you to implant an embryo and have a baby. So that's something the clinics don't tend to look for. I don't know why. I don't understand why they don't tend to look at how your cycle's behaving, but there's no point spending lots of money on IVF or IVF Lite to make that perfect embryo if the foundation's on.
Isn't that? Because it's not gonna, yeah, that makes perfect sense. Thank you. So she does, you kind of touched on this, but she said, what's your advice on diet alterations, acupuncture, supplements? You kind of touched on that just now, but I guess that can be really helpful as well.
Yeah, it's just finding the right fit for each woman. And I would say, you know, you type it into Google and you're going to get a million things, and just cue, you know, overwhelm, and just, maybe I should do this, and so-and-so's neighbour did that, and so-and-so's cousin's neighbour did this, and, you know, after 10 rounds of this, that, the other, they got pregnant. And the pressure to kind of not muck it up or to do the right thing is just immense. And I would say everyone has their kind of own prescription for what their body's going to best respond to. So the best advice I can give is, yeah, do a little research, look at all the things, and then figure out what you're drawn to. And anything that makes sense for you on a kind of cognitive level, but also that you feel like your body's going, yeah, I need that, that makes sense for me. Do those things.
Right.
Anything that you think, oh, I don't really get it, or is making me feel quite stressed or pressured or vulnerable or resentful, any of that stuff, it's not going to be doing anything. Just your body is like your compass. It will guide you and say, yes, please, like
having that trust in your body, because I suppose if you're going through fertility issues, you can kind of lose that trust in your body, can't you? So
yeah, it's very easy to get that disconnect and just to feel continually overwhelmed and tearful and vulnerable and just terrified you're going to muck it up. But yeah, there is a right fit for every woman, I believe, and it's just about coming into that quiet space sometimes, having a chance to offload and then work out, yeah, do you know what? Stressing myself out to go to those acupuncture appointments that I don't even understand and that I don't even like. It's not doing anything for me, I'm not going to do it. Whereas another lady could go, wow,
best thing ever.
Yeah, this totally ticks my box. You know, my mind just thinks that makes so much sense. And I know an amazing acupuncturist, and I think acupuncture is brilliant, and you know, various diets, and there's all sorts of things that you can do. But yeah, when you try and do it all, you tend to just go a bit, well,
Love it. Okay, and she also asked, do you have any feedback on couples' preferred IVF clinics, as it's a bit of an expensive leap of faith otherwise?
I'm on a bit of a mission. Myself and my lovely colleague Kath, who works with me, we're on a mission to find the best IVF clinic that's going to look after our ladies how we feel like they should be looked after. And we've also been going around the various fertility clinics to give them feedback, just to say, you know, actually, did you know that doing this would be really important, and that you're not doing this that actually needs to be done.
Okay.
I think I've not yet found the perfect IVF clinic, but I would say essentially you want to find a clinic that is going to treat you as an individual in terms of the treatment that you follow, because some of the centres are a bit conveyor belt, and it's you come in, you get your protocol, you'll come in 3 weeks time and have this scan, and then you'll have your egg collection on a Thursday because that's the day that our theatre's free.
Right.
And I much prefer that you go to a clinic where they track you each day and say, you're not quite ready yet, let's go tomorrow.
Right.
And if that's Sunday, that's a Sunday, you know, but you come in, and because that's going to give you the best possible chance, because it's actually following your body rather than their schedule. And in terms of naming clinics, I would say Wessex Fertility, I can hand on heart recommend.
And they're based in Southampton?
Based in Southampton, and they have a satellite clinic in Poole.
Okay.
So that's very helpful for anyone in our kind of local area.
Yeah.
Bath also has a very good reputation, and I have had a couple of ladies have a good experience there. And I'm not talking necessarily success rates, I'm talking about the overall, you're going to be looked after, you're going to be followed carefully, and you're going to have a treatment plan that is individualised to you.
That's important, isn't it?
Yeah.
Okay, going on then, we've got someone who's asked if you've got some tips for getting pregnant when you've been told you've got a 5% chance of conceiving naturally due to the likelihood of early menopause. Is it true that you can help improve the quality of the remaining eggs, and what advice would you give on this?
It just makes me so sad when women get told things like this 5%, because I don't think professionals realise how much that just cements itself in there.
Yeah.
And I would say if your instinct is, I feel drawn to try for this natural pregnancy, I would say yes, there are certain things that you can do, and you have to listen in deep and think, what is my body asking me to do?
Yeah.
So which kind of diet do I want to follow? What kind of therapies do I want to try? In terms of egg quality, anything that's to do with antioxidants is very good for egg quality. Taking royal jelly is good for that. And generally do things that are like a hormonal cleanse for support. So things like take out dairy and gluten for a little while, even if you just do it for a couple of weeks.
Okay.
Just to give yourself a bit of a hormone cleanse, so that your liver has less to do and it can concentrate on sorting out your hormones. And then gently look at some of the hormone supplements. Like if you look on our website, we've actually got a free supplement guide, so you can look at the things that make most sense for your body, because I wouldn't sit here and say take this with this with this, because obviously it's different for each person. But if you put these things together and then have a look at what your cycle's doing. If your cycle improves and you think my periods are getting better and more regular, then your body's saying, yeah, you know what, I can still do this. I've still got a chance here, I can still do that. If you're finding that it's going totally haywire, then it might be that your body's saying, I don't want to be pushed in this way, in which case there are some other options, and you'd be looking at things like donor egg, you know, which is not an easy thing to sort of bring up and talk about, but it is an option worth looking at if you get to the end of the road and you would still like to have a pregnancy and you would still like to do it yourself. In that sense, it's something that's worth exploring.
Worth considering.
But yeah, I've known many a lady be told less than 1% chance, and you know, there's nothing, you've got an AMH of less than 0.1, which basically means you've got no eggs, and if you've got any eggs, they're rubbish.
Right.
And they've got 3 children, and you just think, I don't think you can ever definitively say.
Yeah.
Never.
No. And there is 5% chance.
According to this person that's told her that, and just think, who knows?
Okay, so moving on, this again is another person that wants to stay anonymous, but I have one 8-year-old, and after 7 years of trying 3 miscarriages, my husband's keen to go to the doctors and ask for intervention and help. I have PCOS and I have lots of pain when not on birth control, so I want to have one last year of trying and then I need to reclaim my uterus.
Totally.
I'm nervous about what the next steps would be, and I do not want to get his hopes up and then find out it didn't work. I'm not too keen on anything too invasive or artificial. Is there anything natural that could help, and what are the next steps in my situation?
Well, I'm really sorry to hear that she's been through 3 miscarriages. That's horrendous. With PCOS, polycystic ovarian syndrome, you are more prone to miscarriage.
Right.
But I would say if you have had those miscarriages, you are getting pregnant. So it may be that it's a few tweaks to get you to a healthy, successful pregnancy without anything too invasive, because normally fertility treatments are aimed at getting you pregnant in the first place.
Right.
So in the first instance, I would say naturally for PCOS, hugely powerful results from changing your diet. PCOS does not like gluten, does not like sugar. If you can cut those things out, I know it's really hard and it's a challenge to get used to it. But once you have worked out how to do it, it becomes a bit of a routine, and you will notice phenomenal changes with your cycle. Some women will respond to that. Acupuncture is also good for PCOS. And I found about half and half women natural things, and half the women you can go to your GP or your fertility specialist and look into something called metformin, which is a drug that you take. It's basically a diabetes drug. Right. It works for PCOS because on the way that PCOS works, well, we won't go into it too much, but the insulin resistance that you have impacts your hormones, and so if they can use drugs to adjust your insulin resistance, you usually find that your cycles get better and everything starts to function better. So if she wanted to look into that, that's it's not the nicest drug to take, but she might want to try the natural options first. Other than that, I would say she's also, if she's had 3 miscarriages, she is entitled to go and have blood tests to check if there's any underlying cause for the miscarriages, because actually 3 in a row is very unusual. Like 1% of women will have 3 in a row.
Oh my goodness.
99% of women who've had 2 miscarriages in a row will then have a healthy pregnancy. Right. So it would also be worth exploring when were those miscarriages, what were the circumstances, because it might be that actually there's something going on there, that it might be something as simple as taking aspirin or something that's gone on that she would need to obviously go through that with her medical professional.
When she had the miscarriage, how early on and stuff, would that give you an idea?
It would give you a clue. It gives you quite a lot of ideas to perhaps the cause of the miscarriage, but as I say, with PCOS your chances of miscarriage are slightly higher anyway, sadly, but it does sound like she really has a good chance of going on and having a healthy pregnancy. But I would try the diet. That would be my first port of call. Yeah,
brilliant. Okay, then Kelly has messaged in. She said, after a failed round of frozen IVF, how long would Lucy advise to wait until you try again?
I would say that's based on how are you, what do you need? For some women, they are so emotionally broken, they need a minute, they just need a bit of time to piece things back together, and sometimes that impacts on their body, so it depends. How is your body now? How are your periods? If you're just finding everything's kind of gone to pot, then it's worth having a bit of time just to nurture that back. But similarly, lots of women, I just need to get going again. I just need to get back on the horse. And if you feel driven to go for it, then just go for it. Yeah.
So listen to your body again, really.
Yeah.
Kelly also said she's, after this IVF treatment, she's been suffering with really severe headaches and sickness still happening. And she said, is this a normal side effect? And why is it still happening this long? How long should it happen for if it does?
Okay, that's Kelly as well. Then I would say that can happen as a side effect for the drugs. They don't seem to warn you about that, which I think is a shame, because it's a bit of a horrible thing to have gone through a failed cycle and then have this horrible symptoms and side effects. What I would say in that case is do a hormone cleanse. Do like a month or even 2 weeks. I've got a really nice hormone cleanse diet on my website, which is literally nothing crazy, but you're looking at just eating things like fish, chicken, pulses, meat, and then adding in lots of green leafy veg, lots of nice fruit, vegetables. Essentially try to cut out dairy, alcohol, sugar and wheat for a couple of weeks, just to give your body that break, because your liver works so hard with all the drugs.
Okay.
And when it's trying to get them out of the system, and if you add in all the emotional trauma as well, you just need to lift that pressure from your body and go, I'm just going to give you really simple things to digest, and then the body can get back into its hormone production and sorting everything out. And usually I find a couple of weeks of doing that and doing whatever you need to kind of be scooped up and looked after a bit, then everything will start to sort itself out. And she will probably find the next period is better, and then the bloating will go down, the sickness will ease, and all those symptoms will disappear, and then she'll be ready to go again.
Oh, that's brilliant. Hopefully that will help. Okay, another anonymous one. I've been trying for a baby for 8 months now. I use ovulation sticks, so I know I'm trying at the right time, but I haven't fallen pregnant yet. When would you recommend seeking advice and tests to check everything's okay?
Okay, well, it is really normal for it to take up to a year. For most couples it is somewhere up to a year. You just never know when they'll roll the lucky sticks. But I appreciate 8 months feels like an awfully long time, and it's very frustrating and really, really difficult.
It's when you get that negative, don't you? You think, oh, I've got to wait a whole month now until I can try again. It's like just eternity, isn't it? To try again. It's
really hard, and also you're going to go to the GP and they'll say, you need to wait for a year before you come in. So yeah, she's in that position where she's kind of stuck for 4 months unless she kind of fibs to her GP and says, oh, I've been trying a little bit longer. If she wants to get, just some basic blood tests done. But again, it's that thing of, I would say you're probably fine. It's just waiting to roll that lucky six. And if you need to be doing something, which you probably do, because you're going to go absolutely nuts waiting and the frustration is just hell, then have a look. Like, I would love to chat to you, to say, well, what's going on? Let's have a look, and let's have a look at your period, and let's figure out. So give yourself a little bit of a look at what your cycle's doing. For example, you could temperature chart for a month and see what the pattern's doing. And you want to see not just when you're ovulating, but where are you ovulating in relation to when you're having your period. So your ovulation and your period, that luteal phase, should be at least 10 days. And if it's not, or you're brown spotting before you come on your period, then those are things that probably need attending to, which again you can do through supplements and diet and the fertility massage. There's all sorts of little bits and pieces that you can do. It's hard to know without kind of unpicking her actual situation, but I would assume she doesn't want to wait 4 months to go and get checked out. So I would say, well, chart your temperature and have a look on paper. What's your cycle doing? And if you need any help deciphering it, just get in touch.
I think that's brilliant, because I know when I was trying, I was one of those people that was crazy, like from the minute we started. I was like, right, I'm on ovulation sticks, this is the time, and I had it all planned out, and I was a bit mental with it all. But I think wouldn't have even thought to look when I was ovulating to when my actual period came on. That wouldn't have even crossed my mind. If I was ovulating, I could get pregnant in my head. That was all I thought. So
absolutely. For someone it's like, well, ovulating a bit late, we need to bring it early, otherwise the egg's not that fresh, and maybe that's impacting your fertilisation. It's a nightmare.
Love it, thank you. So we've got someone, I'm 39 years old. This is Laura. I've been trying to conceive with my partner for 3 years. Is there an age limit for IVF if we did consider this option? So I guess she's probably feeling like the clock's ticking. Is there?
Oh, it's so hard, isn't it? No, there's no age limit. If you're going for IVF on the NHS, it's a bit of a postcode lottery, so it depends where you live, and you have to check out what your local clinics are offering in terms of what their criteria is. And for some, bizarrely, it's you have to be over 38 or over 40 to qualify for IVF, and other clinics say you have to be under 40. But it's worth just checking out what your local situation is.
Okay, brilliant. Anonymous again. I'm due to start my first round of IVF and I'm really anxious about it. Is there anything I can do to help the process? So I guess she's feeling before she actually goes, what can she do to maximise her chances, I guess?
Oh, absolutely. I would say head over to our website. We've got a free mini IVF support kit, which is basically like a cheat sheet with all our best top tips for how to maximise your chances, how to kind of calm yourself down and help support yourself. There's also a free audio track for our embryo transfer techniques, which will teach you how to relax your uterus for when you actually go and have your embryo put back, which is just a way to kind of enhance your chances, because what can happen is actually when they put the embryo back, they insert a tiny catheter and the uterus kind of spasms and wonders what on earth it is, and the spasms can continue for up to 2 days, which obviously when you've got your little embryo in it, it might be just expelling it.
Yeah.
So there's just lots of little tips around that, and I think for most women, when you have a plan, you feel
in control, don't you? And then calmer. Yeah.
So
and then we had someone we were talking to yesterday who's having IVF, and she was actually saying that when she had the treatment, her uterus did clamp. She did have really bad, and they actually said that will reduce the chance of it working if it's severely cramping like that. So the relaxation of the uterus would be perfect, I guess, wouldn't it, to help that?
Yeah, if you just go onto the website, it's right on the front page under the free products, and you can just download it, and then it's all there. So that's a nice little.
We'll actually pop a link to that as well, so people can go straight through to that. That's brilliant. I've been prescribed with clomiphene.
Yeah, that's Clomid, same thing.
Oh, okay. Yeah. What is the success rate of this drug, and am I likely to get side effects?
Right, clomiphene is a drug to help you ovulate. So obviously if you're not ovulating, then that's great, because that will hopefully give you that last missing piece of the jigsaw. They say that if you're taking Clomid for 6 months, your chances of getting pregnant are about 50%.
Right.
I would just say if you're already ovulating, sometimes clomiphene is that first port of call when you go to the fertility clinics.
Yep.
They've got kind of IVF here and they've got Clomid here, and they just go, well, let's start you off on here and see what happens. And they do admit there's a little bit of a placebo effect on the whole. You're taking a tablet, it's going to help you get pregnant, and you know, sometimes that's enough.
Yeah.
And sometimes it does help women who are already ovulating to ovulate in a better way, kind of a little bit earlier, which can impact their chances of a good egg fertilising. The side effects can be quite severe for some ladies. Some ladies seem to just sail through, and other ladies they feel nauseous, they get headaches, if they're not pregnant on that cycle, they get quite a nasty, heavy, difficult period.
Okay.
So yeah, it's not an easy drug to take actually.
I think sometimes you kind of hear of it being given out quite
Like
frequently,
Smarties.
and you kind of think, oh well, that's the easy option. I mean, I wouldn't have known that there was those kind of side effects. It's quite a thing to think about before you actually just rush into it then.
Yeah, I would say let's look at everything else, just in case there's something else that's going on before you like leap into
that.
Yeah.
Brilliant. And then we've got Laura. She said, I've been on the pill since I was 16 years old. I'm now 32 and I'd like to start a family. Will the fact I've been on the pill for such a long time affect my fertility and chances of getting pregnant? I know this one resonates with me. I was on the pill before I came off to get pregnant, and I thought, it's still going to mess my chances up, it's going to make me infertile. I don't know why I kind of had that, but yeah.
It just doesn't seem to be a problem. No, it's there's no evidence to suggest that it has any impact on your fertility. If anything, it just kind of puts you on pause for a bit, really. And then what I do find is that either women come off the pill and bang, straight away pregnant, or it takes a little while for your cycles to come back. And that doesn't mean there's anything wrong. It just takes a while for your body to realise what it needs to do and kind of get the factory going again. So it can be frustrating in that you're waiting sometimes up to a year to get your cycles back properly. But yeah, you can absolutely get pregnant in the meantime of that.
So the length of time won't affect it.
No.
And lastly, my husband has a 4% sperm motility and we're struggling to conceive. Is there anything you can do to improve the motility rate? So obviously we've talked a lot about the women's side of the fertility in the body. Is there anything that the men can do to help with theirs?
Well, the lovely thing about men is it's just like straightforward. Like, okay, there's like, 3 things you can do that make a massive impact, whereas with women it's like there are a million things. Yeah, it's just huge. But I would say the best thing for guys is you want vitamins A, C, E, zinc, selenium, and you want something antioxidant. So if you can get something like super green powder that you put in a smoothie, if you can persuade him to take that. There's something called Proxeed, which is an amazing supplement that you can buy. There's like a little powder that you put in a drink, and it's all the relevant vitamins, but all the antioxidants as well, and that just has a phenomenal effect on sperm, and that's what most of the urologists are recommending.
And where would you get that from? Is that like a health food shop? Or?
You usually have to buy it online.
Online?
Yeah. So if you just Google Proxseed, it should come up, and that seems to be the best thing. But if you can't have that, or your chap won't have that, then just try getting those vitamins into him, and as many.
Sneak it into his food.
I mean, naturally they have things like tinned tomatoes are supposed to be very good, Brazil nuts.
Okay.
They're on like a 3-month cycle, these swimmers.
Yeah.
So actually, once you get started, give it 100 days and you get a whole new batch of swimmers that can be much, much better. And you know, men have that ability to just change things as they're going, whereas of course for us, our eggs are there from birth.
Yeah. Well, that's fantastic. Well, that's all of our questions. If you do have anything else, I mean, you've just given us so much information, it's been absolutely brilliant. But if you do have any other questions, Lucy's really kindly said she will answer them. So you can pop any questions in the comments below, and Lucy will pop on and answer any that she can. But don't forget to check out her website, www.catchingrainbowsfertility.co.uk. We'll put a link as well. But thank you so much, it's been brilliant.
You're welcome, thanks for having me.
Thank you.